the Washington Post and New York Times obtained a secret memo from the White House last week. And it was basically Donald Trump's HHS budget proposal. And what the administration wants to see is about 1/3 of HHS budget cut, which is about $40 billion. That's a B, billion dollars. CDC's budget would be cut in almost half. NIH budget would go from 48 billion to 27 billion. Routine inspections to food facilities are going to be entirely put on states. They are going to add, or they want to add $500 million of research to fund the MAHA initiative, which is now called AHA, which is RFK Jr. would control that fund.
So basically they're gonna gut the NIH.
Yeah.
And then they're going to put $500 million directly under the discretion of a non-scientist to guide science. Like that's what this budget lays out. And meanwhile, anything that you actually discover out of that science, all of the agencies that would be using that to actually turn it into public policy are also getting gutted. I mean, this is a wild thing. And I want folks to understand what they're trying to do with this budget is they're trying to formalize all of the DOGE cuts in ways that now sit in federal law. And you know, the danger of this is that we all get worse public services. We're watching as independence in a lot of these agencies, as we just talked about, is getting cut and is being directed directly behind RFK's pet projects. And it's really, really difficult to come back from these things. The other important note here, just for folks who are watching, they are not articulating any cuts in Medicaid or Medicare. So at least that's a good thing. But this is a really dangerous thing. And I think for all of us who just, paid a tax check, we're asking, where do our tax dollars go? And increasingly, right, they're not going to the things that are benefiting our society. I mean, HHS is one of those things that, I think most people agree on. And it's getting wiped out here.